Thank you very much for organizing this event. I'm grateful to everyone who has come, and I'm happy to see my old friends. We are going to have two messages or sessions from me. One is on appreciating our nation and our people in Uganda for the various efforts that they have put in over the years, and most recently when Covidex came out. I will give my message of appreciation to each one that has contributed greatly to see Covidex where it is now. And then the second phase will be about Covidex. So I hope that I'll try to be Professor Ogwang used to say, succinct, give a succinct account, brief and accurate, of something. I hope that I utilize the time well. Yeah, this chair, I'm not used to it, so you'll bear with me. Because of my long bones, it's not very easy to be comfortable here, but I'll try to be. Yeah, so allow me to read my message of appreciation to Ugandans. It will not be too long. Yeah, so to all Ugandans, greetings and praise be to God in the highest. This is a message of appreciation to Ugandans who have worked with Jenner Company in this journey of development of Covidex herbal product for supportive management of viral infections, including COVID-19. We have worked with both scientists and non-scientists in Uganda, and I bless God for His wisdom and timely work He gave us to develop this product, Covidex. First, I want to express my gratitude to His Excellency Yoweri Kaguta Museveni Tibuhaburwa for his kind and patient heart as the President of this country, and also for his unwavering support to scientists to find solutions to our challenges. We all know how much I've been talking about supporting scientists. He has never given up. He has pushed different government agencies to give money to scientists, and Covidex is one of his great efforts to support different scientists in this country. I pray that God continues to give him wisdom and good health as he leads this country. I want to thank the State House team, led by the State House Comptroller, Madam Lucy Nachobe, and the President Person Doctor herself, who came to visit me when things were really very difficult. And the Uganda Police, led by the IGP and the Deputy IGP and all this team that came in quickly to give support to security, both to myself and also to the factory. I want to express my gratitude to Dr. Leoda Tumwesije, the former Minister of Science, Technology and Innovations, and his team at MOSTI, especially Dr. Maxwell Otimo Napa. Because when COVID problem began, 2020, scientists were called to go forward and give the solution, provide an option. I also went in front and proposed my idea to the team then, but this idea was ignored by the team or the select committee that handled COVID funding. However, Dr. Leoda and his team called me and told me they want me to do something. And early this year, they asked us to write a proposal again. I did not want, because I was very tired of writing. You know, it takes a long time to write a proposal. You write a proposal, it's evaluated, it's okay, then along the way you are thrown out because money has come. It hurts. So I said, I'm not going to write another proposal. I'm tired of these things. But Dr. Leoda kept on calling, Maxwell kept on calling, and now people kept on calling, my own team kept on pushing me at Barrow University, let us submit. So eventually we submitted. And then in April this year, Dr. Leoda and his team gave us some small amount of money. And in June, we began evaluating this product again. It was an old formula. I'll talk more later. Quickly, we worked with PhD students, grad students, to produce data again to give to NDA. And I thank God that we are where we are now. I thank the leadership of Bahrain University, Science and Technology, where I work. Because of their leadership, scientists and professors have an environment to explore their talent. They always listen to us. They give us any help that they can provide. So we're able to do experiments, do research, and come up with something. Especially I want to thank the government of Uganda and the World Bank that set up African Center of Excellence to do research on precious medicine in Uganda. Because that Center of Excellence gave us equipment, gave us very bright students, good bright students from different parts of Africa, from Nigeria, Ghana, Rwanda. So we have all those students. And if you go to developed countries like the US, professors work with talented students of PhD. They're the ones who do the lab work, you guide them and do lab. They run experiments quickly and you guide them, and things can move faster. So I thank government for setting up the Center of Excellence, and also I thank leadership by Dr. Kasim Umbatolo, whom I deputize, and also support as a principal investigator of the center. I want to request government to continue supporting this center and other centers of excellence in Uganda, because such centers of excellence are those that conduct high quality research that can transform our nation. Africa has about, maybe Eastern and South Africa has about 24 centers of excellence set up by the governments of different countries and the World Bank. If these centers are strengthened and research is encouraged, Africa will stop begging from other continents. We'll also be giving other continents solutions to handle their problems. I want to thank the PhD students who worked with me. Laura Joseph, the toxicologist, Ajay Clement from Nigeria, from Cognosis, and very knowledgeable in HPLC analysis. Angupale Jimmy, a Ugandan, and a specialist in pharmaceutical science. Then a young man called Kawa. These are the students whom I worked with day and night to generate data that we could submit to NDA. I also want to thank Ugandans as a whole. Last year when COVID came, the president organized prayer for corona disease, for God to help us. This year again, the president called for prayer for God to help us. It has not been in vain that we have been praying as a nation. Some people laughed that instead of doing research, we are there praying. But that God never fails us. God never fails those who pray. While we are praying, we are not sleeping. We are also doing research. And Covidex is God's answer to our prayers. I thank government and all Ugandans who pray. I also want to thank Ugandans who have given us feedback on Covidex. It was a fast development, rapidly developing. People began using it, and they began informing us about the product. And we have helped us keep on everybody was making this product and moves forward. And the medical doctors, the pharmacists, the nurses have been sending me several messages about the product. They know we are grateful this far. The product has reached. For the wisdom, I want to thank the CEO of Uganda, the board of pharmacists in Uganda. We are doing our habit. When everybody was making noise against me, they came out strongly. And they said, Professor Ogwang, we know his work. We're going to support him and work with him to see that this product moves forward. And I thank God very much for them. And for the council members led by Dr. Pamela Achi, Secretary Samuel Opio, and others who supported the team to stand strong. What you did, and I want to thank the National Authority led by Dr. Bitechi Rezo. Thank you very much. And his secretary, Dr. Nahamia, 2006, David, and other staff of NDA for acting wisely. So the directors of general, they knew my formulas. They knew my work, but I have run very quickly because of the epidemic we were facing. When I met them, they were considerate. They were considerate because they had known my work before, and they worked with me to ensure that all the data which was required was submitted, and they could approve Covidex. So I thank them very much for the wisdom they showed in this process. But I want Ugandans to know. My team at Jena Herbals Limited, led by the CEO, David Julius Okech, they are standing. Why did we choose like the real CEO? Can you see? When he walks in, everybody knows that the CEO has entered. They have been working very hard, day and night, to ensure that production continues. The demand is overwhelming, We are doing our best. We have the raw materials. Sometimes we lack bottles. Sometimes mainly it's the bottles. Our country can't produce enough bottles. But otherwise, the drug itself, we have it in abundance. But it's working very hard to ensure we get bottles, medicine, as many as possible to supply the entire nation. So thank you very much, team of Jenna, and for the hard work you're showing. I want to thank Rocket Health. You know, Covidex moved so fast. Apart from production, we lacked other system of distribution, communication, and all the things. But Hope, thank you very much for setting up Rocket Health with your team. We are here because of Rocket Health. So you've helped us a lot in streamlining distribution, in ensuring that clients are a bit happy, even though the product not enough. You've done rationing. If you're after money, you would have just sold boxes and boxes, but I discovered that you are rationing so that everybody at least gets something. Thank you for that kind heart and for that Christian heart. We are doing our best to ensure that Covidex is as available as, what's the most common thing in Uganda? Maybe milk. As available as milk in Uganda. I want to thank the many government units that have supported ENGEU Herbals Limited and Covidex development so far. The area of raw materials was becoming a problem, but through the help of the president, I could meet different offices, and now we can access raw materials in abundance. I'm grateful to those different institutions, National Forest Authority and Ministry of Environment, Water, Land and Environment, for the support they have given us. Finally, I want to thank two people who are very helpful to me. One is my personal assistant, Rebecca Mwanje. She's there. Thank you very much, Rebecca Mwanje, for the great support you have given me. I also want to thank Mauda Chamanya, who is behind there. That lady did a great work at the beginning. A great work, and I thank God for her. I will not mention what she did, but thank you very much, Mauda, for what you did, and with your friend. And lastly, I really want to thank my precious wife, Dr. Lilian Wambu's Ogwang. If it was not for her, I would have died. Because with the pressures I was in at the beginning, if you don't have a strong, wise woman near you, you can collapse. But she has been a great lady, and she's a great lady indeed. I thank God for her. And lastly, God Almighty. It is Him who grants wisdom. It is Him who guides. Without Him, nothing good can come. Even those great scientists who have discovered things and said that there is no God, it's God who is guiding them. So I thank God Almighty, our Lord Jesus Christ, for His guide this far. Thank you very much. So now I want to talk about Covidex and ENGEU Herbals Limited. So ENGEU Herbals Limited is not a new company. I registered it in 2007. But the research on herbal medicines under ENGEU Herbals Limited began in 2006. So 2006 up to now is how many years? 15 years. So ENGEU Herbals Limited has existed from 2017 or 2016, no, 2006 to 2021, 15 years. That's why you can see that we have some capacity to produce. If we had begun yesterday, or just because of Covidex, we would not be able to produce and match, at least try to provide on the market. So systems have been there. Though it has been like, I don't want to say briefcase company, no, we have offices, but it has been like a small unknown company. But it has produced or developed high quality herbal products that many Ugandans have used and appreciated. So the directors of ENGEU Herbals Limited are four: myself, my wife, David Julius Okejo, and Mauda Chamanya, who brought them recently because of the contribution they are making to the company. So we are located currently at Akrite Estate, Akrite City. That's where we're located. Our office is there, our operation unit is there. But soon we'll be moving to a bigger space in industrial area, Luzira. David is working very hard to ensure that we move there. And our facility is approved by NDA. They inspected us 3 times, and they confirmed that we are doing the right thing. Now, Covidex. Covidex is a formula that has existed for more than 10 years, but not as Covidex. I have studied 2 plants in Uganda diligently. I've known their traditional uses. I have known the compounds in them, their pharmacology, and their toxicology in depth. And I published several papers on these 2 plants in Uganda. These 2 plants are the backbone of Covidex. Even when people were making noise about safety, about efficacy, I knew what was in the market. Because it's an old formula we used some time back for different diseases. We only repurposed it for COVID. You cannot develop a COVID drug or a medicine for a disease that just come up from zero. Most of the drugs being used now, even remdesivir, ivermectin, they were for other purposes and only repurposed for this disease. That's what we did at Herbal Limited. So, we had to generate data fresh because we want to submit data in the names of COVID. But we had data for those products that have the same formula. We just adjusted. Now, Covidex, when we were developing it, we were focusing it for COVID. That's the truth. When we were evaluating it was for COVID. But after meeting with NDA, they advised us to change to viral infections. To some extent, they are right because COVID is a disease of politics. You know, you talk about COVID, everybody wants to jump on you. And also, we also need a randomized control trial to know exactly the contribution of Covidex to COVID-19. So they are right as scientists. And up to now, we emphasize that Covidex should not be used alone. Let it be used as supportive therapy until we establish if it can be a standalone treatment. So let's use it alongside other medicines that are recommended for treatment of COVID-19. And very soon we're going to run clinical trials. We already developed the clinical trial protocol, and we're going to have the data of the clinical effects established scientifically. But I want Ugandans to know that when it comes to traditional herbal medicines, worldwide, whether in the US, whether in Europe, whether in WHO or in Uganda, the requirement for clinical trial is an added advantage to a product. You understand? Almost all products registered by NDA in Uganda, both imported and locally developed, there is no clinical trial done on them. They are used based on traditional medicine knowledge and available laboratory evidence. That's why NDA went ahead and approved it as a supportive therapy based on traditional use of those plants. It's not a requirement that we should have clinical trial data to have a product on the market. No. But to prove beyond doubt, especially when we are to export to other countries, we are going to do clinical trial and we establish the level of effectiveness of this product. Because to me, it's a great potential for our country to grow economically. We can export Covidex and it becomes the gold of our country. And that's good for our nation. Why did we choose Rocket Health, Springs, and EcoFarm? We want to focus on manufacturing as Herbal Limited and let these teams, these companies, and others to come handle the distribution. You cannot do everything. Herbal Limited wants to focus on manufacturing and do more research. There are other 3 formulas we are working on, still focusing on COVID-19. They're in the pipeline. So we want to focus energy in research and in production. So we chose immediate companies that were already interacting with us, Rocket Health, Springs, and EcoFarm, to help us in supply chain management so that this product can go far and in an organized way. So I'm grateful when we contacted them, they are willing to come and support. And I think it's a good spirit we should have as a country. Let's cooperate, let's specialize, let's do what we can do best, and then we can maximize our energies and our talents. We are going to get more distributors, especially now looking at up country, because many people in Karamoja, Arua, Kabale, they're calling me, we need the medicine here. And I think with the effect from this week, we're already organizing by regions, different regions in Uganda, and then picking out distributors there, so we can also start. We're already sending products, but in a limited amount, But with effect from this week, we shall be sent to every part of Uganda where our agents will be. So I want to encourage Ugandans to be patient. I know we can't be patient when we are sick, but we are working very hard to ensure that every part of this country receives Covidex for those who need it. I also want to take this chance to appeal to Ugandans. Please, let us not hoard Covidex. There are some who are buying to go and store. It's bad. Because there are those who are sick who need it. For you are not yet sick, but you are storing. That's bad. Please, let's leave it for those who need it. We shall not stop making this product. We are making it every day. So don't store it there when your neighbor needs it and they are sick and they are dying. I want to clarify on the features of Covidex. It is sad that we like forging things as a country. It defeats my understanding. This is something that saves life. And you want to forge and let somebody die because you're making money. It's really bad. You can forge something. You can maybe forge food. You can maybe forge a trouser. But don't forge a medicine. Because you are personally killing somebody. You are actually killing the person who is taking it. Make sure that anyone who is forging anything on Covidex or so, there are some people who have tried to forge, but we have caught them. They call it as caught with the help of police. Whatever that means. And we're going to make sure that anyone who is forging anything on Covidex or other product will not go. They call it as scot-free, whatever that means. Because we have just started, we shall catch them and they shall be punished by government seriously. Now, right now, we are using locally made bottles to produce Covidex. Because different companies have different locally printed labels. Different shapes are coming up. That's why you see. Because we have just started and want to work with local companies to promote Bubu. Today the cover is green, but we are facing a challenge. Light green, that one. Because different companies have different bottom molds, the different shapes are coming up. So we are really struggling. You go to best pack, they have a different the bottle presentation or size. But very soon, you go to Blow Plus, they have a different. So they are changing. So that's why you see quantities every day. The bottles is changing. Tomorrow, today the cover is consistent. Green. Tomorrow it's light green. Holiday is dark green. Bottle shape and everything. Because we have to go to different companies. We are also doing our best labels to imprint Jenna. So we are really struggling. The logo of consistency on the bottle. In the bottle presentation. With that Jenna, but very soon we shall get a company that will produce large quantities of what we can focus on. One. Buy Covidex from of same consistency pharmacy. That shall be consistent botany. Okay. The cover from hawkers. The bottle shape and the hawkers are the ones who are selling. We are also doing our best to imprint buy from Jenna. The logo of Jenna on the bottle. So when you find it with that Jenna, you know it is genuine Covidex. But for now, for the public, what we can focus on: one, buy Covidex from a licensed pharmacy. It's well packaged. Or drug shop or clinic. Don't buy from hawkers. And then ensure that just as seal. The hawkers are the ones who are selling fake ones. These plastics. Don't buy from individuals. Go to a pharmacy. And then, if not there, when you wait for us to supply again. But we're trying our best. There should be a strong aroma. If you are a wholesale, if you are a retail pharmacy or clinic, you can know that this is the real test of Eco Farm or Rocket Health or Springs. Now, you are sure you will get Covidex. For the public, when you get Covidex, first check that it's well packaged and labeled with Jenna labels. And then ensure that just has seal. If there's no seal, someone has broken it. This plastic seal is important. And then, when you open it, there should be a strong aroma. And also, the taste of Covidex should be there. If you have not tasted, you can come to Rocket Health, they give you just for testing. Then you can know that this is the real taste of Covidex. Now, how do you use Covidex? When you get Covidex, when you need it, please, not when you don't need it. Don't buy it for putting in your pocket and walking around with it. It's not a phone or other thing. It is a medicine that saves life. You need to first check that it's sealed, check that the expiry date is okay, check that it has the label of Jenna, at least as per now. And then, before using it, you must open it. Open the bottle and break the seal. When you break the seal, you put the cover in the clean place. Make sure you have removed this plastic seal. It can kill you if you land to kill yourself. think one lady in a hurry was sick, she dropped it to the stream. But thank God she was rushed to the hospital and they removed this to survive. But this cow can kill somebody. So once you have opened it, we recommend for adults, that is 13 years and above, 6 drops 3 times a day. For 12 years to 12 years, 3 drops 3 times a day. The mouth, not only for the throat. And then for below 5 years, if they have a problem, below 5 years, they can't get COVID. But now they're going to COVID or infection. We recommend 1 drop 6 times a day, but be guided by a medical doctor, a pharmacist, or a nurse if the child is below 5 years. And then there are those who have what we call comorbidities, other diseases alongside the infection, like high blood pressure, diabetes, pregnancy, and other diseases. Please consult with the nearest health worker to guide you, because it's important for you to monitor your parameters. If you are hypertensive, this drug may increase your blood pressure. Not so much, but it may increase it. So if you have your BP, you can monitor or you can be helped by. If you're diabetic, this drug synergizes with diabetic medicines. It increases the ability to lower blood sugar. Because already the diabetic medicine like metformin or glucosamine already is lowering blood sugar, when you add this, the sugar may be lowered, may be reduced much lower. So also monitor your blood glucose and also seek help from a health worker to guide you. If you are pregnant, we have heard that we're not very sure of the effect in pregnancy, but in the rats there was also called teratogenic effects. It doesn't cause harm to the baby, but it could cause contractions to pregnant women. So it should be used carefully under the guide of a health worker if the lady is pregnant. For breastfeeding mothers, we do not know how much released in the milk yet, but we do not anticipate a lot of harm to children if passed through breastfeeding. But still, let's use it with caution. Now, the dose for adults is 6 drops 3 times a day, and for children, 5 to 12 years, 3 drops 3 times a day. Those below 5, 1 drop 3 times a day. And how do you administer it? How do you take it? You must look up to heaven, like I'm doing. Look to heaven, open your mouth, drop it between your tongue and the roof of your mouth. Maybe you count to 10. Why do you count to 10? So that the medicine remains in your mouth as long as possible. Because we know now, the first place that the virus gets into and sets up its factory is the throat and the nose. And then begins multiplying in your throat before it goes down into your lungs and other organs. So Covidex is designed to first target the virus in the throat. Once you target it there, you have targeted the factor of the virus. You stop it there, you have handled it early enough. And actually, if you start early, as soon as you get the symptoms and you start, most people do not progress to complications of the disease. So that's how you use Covidex. After using it, make sure that you close it using the cover tightly. And then keep it in a safe, cool place or dry place away from where children can. Children like medicines. So we normally keep it where medicine is stored safely there. Wait for another 8 hours, do the dose again, and 8 hours, do the dose again. Now, from our research so far, 7 days treatment is adequate. Any adult needs only 3 bottles, not 7 as we had estimated. 3 is enough for 7 days. And then, for those who have delayed to start, they may take it for up to 14 days or longer to recover. But if you start early, within 7 days, you should be getting better. Finally, no, not finally, second last, the pricing. I've received hundreds of messages about prices going very high, skyrocketing prices. Now, I want Ugandans to know that Gena Herbals Limited, from the very beginning, the objective is not to grow rich. We began Gena Herbals Limited not to make money, but to help people. All our products, whether Gena Cough, Gena Seed, Gena Pep, whatever it is for any disease, they are very, very affordable to all people. You can go and do your market research. So when we developed Covidex, we knew that Covidex was a highly demanded product that we could make a killing from. A lot of money and become rich, maybe the richest Ugandan within a few months. But our company principle is humanity first. So we said, let Covidex cost only 3,000. We're not just making a small scale, it was 3,000. But when we brought in more workers, the cost of making now increased up to today. In fact, up to yesterday, I haven't yet the fact up. By yesterday, at the factory price, it is 5,000. Now it is 6, eh? Yeah, because of now importation of butter, so it is now going to 6. So we give it at factory at 6,000. We don't expect someone to sell it at 20,000, 50, 100, 200. That is greed. So I want to appeal to Ugandans. Let's not take this chance to make ourselves rich, because you never become rich through such methods. Let's take the chance to help fellow Ugandans who need the medicine. So we expect, like, if we factor it at 6, wholesalers can add like 2,000 to make it 8. Pharmacists can add like 2,000 to make it 10 or 12 to be at most. Because if we sell at 12,000, means a full dose of 3 is at 6,000. That's affordable to our people. So I want to encourage Ugandans, and I want Ugandans to know that the price of Covid at the factory is 6,000, and don't expect anyone to buy it more than 10 or 12,000. Right now, the people are taking advantage because the demand is high and the product is not available. But in a few coming days and weeks, we shall make sure that this product is available in every district, in every health unit. Thank you. There's a last point, opportunities that herbal medicine presents. Now, I teach to study all types of medicine, pharmacology, natural and pharmaceutical or chemical. I am trained as a pharmacist to study to focus all types of medicine, herbal medicines, natural medicines, and pharmaceutical or chemical. But Africa, I chose to focus on nature, herbal medicines or natural medicines. Why? Africa is richly blessed with nature. Uganda especially, I think, has 13% of the world biodiversity. I think it's a country in the world that has the highest, maybe the second highest type of nature, different plants and birds. Uganda has maybe the second in the world, apart from Amazon, I think. But in Africa, we are the leading. And any part of Uganda, trees can grow. Even Karamoja, which is considered a desert, when I went there, I found there are trees growing. Aloe vera was there, a very different type of aloe vera, very big like this. Different trees are there with medicines, different medical effects. So, herbal medicine presents a great opportunity for our country, both in terms of discovery of drugs, even modern drugs. They come from plants, they come from nature. But also, herbal products, because some people also actually, majority of people these days are looking for natural things. When I used to work in a pharmacy, people come and say, do you have something herbal? Because of the belief that it is safer. The chemicals, people are running away from chemicals. Even internationally, people are trying to avoid chemically designed things. And the reason is that, nature, when nature designs some things, it interacts with nature also, isn't it? When a plant is growing, it's interacting with insects, interacting with human beings, interacting with the snakes. So interacting with natural environment. But when a chemist or pharmacist is there in a lab trying to combine different chemicals, maybe combining benzene with the chlorine to produce another compound, there's no interaction in nature there. Eh? It's artificial environment. When it comes to the public, then it begins to interact with nature. So most times you may not see what happened in the lab and you see it in people. Which is different from herbal medicine. Herbal medicine, because nature is ecology, the interaction between different species. So the land. That's why practically hardly do you see extreme toxicities in herbal products. They can occur, yes, there are plants that are highly toxic, and they can have very dangerous compounds in them, but we always tell them and know which class of plants have those kind of highly toxic compounds. But for majority, side effects can occur, but not toxic effect, if used at the right doses. So as a country, we need to invest in research and development of herbal products. Because one, we have the raw materials abundant in our country. Secondly, they can be of medical value to treat diseases that we have. And thirdly, they can be of great economic value. Industries can come up. Right now, Herbals Limited is employing many Ugandans, is buying locally produced materials. Like now we're going to spend over 300 million to get raw materials from southwestern Uganda. That's money going to the population. That money could have been exported to other continents to buy the raw materials, and we lose. But that money is remaining here. It's going to build our economy. It's going to build our own people. So that's why herbal medicine sector, it's the easy way for us to invest as a nation and reap very quickly and faster. So I pray that as a country we look into it more. Rocket Health, Springs, and EcoFarm, thank you very much for providing the support. Jenna will focus on research and production, not only of Covidex. We have about 13 formulas, excellent ones, and we're developing more. Thank you very much.